My name is Dr. Hillel Mazansky, and I'm coming to you today from San Diego, California. My areas of expertise encompass medical hypnosis, guided imagery, nutrition, and exercise. Please read my new book titled Empower Yourself with Medical Hypnosis, available on Amazon.com. Reading the book allows you to live a longer, happier, healthier life. Today's health tip is titled, Are you at risk for a clot or a thrombosis? Deep vein thrombosis is the result of clotting of blood, usually in the leg, either in the thigh or the calf. 500,000 Americans annually develop DVTs or deep vein thrombosis, and with 100,000 deaths. The problem is that if a piece should break off, it can then land up in your lungs, causing what is known as a pulmonary embolism, which can have life-threatening consequences and even death. The signs of a deep vein thrombosis are usually pain, swelling, and redness in the leg, and difficulty with movement. Anything that damages the inner lining of the vein can cause a DVT. Blood that is thick and travels too slowly can cause the issue. Other causes are hormonal, genetic disorders, and sitting for a long period of time, especially in an aeroplane. People who are at risk for a deep vein thrombosis are patients with cancer, people who've had surgery, anyone with extended bed rest, the elderly, smokers, long-distance travelers, and females who have delivered a baby. Also, people who are overweight are at greater risk for developing a DVT. Females have a greater risk of developing deep vein thrombosis than males, as I mentioned, mainly during pregnancy and for a period of 4 weeks after delivery. Females take the oral contraceptive pill, and anything that raises the estrogen level in the blood, such as pregnancy or the oral contraceptive pill or hormonal pills, these increase the risk of developing a deep vein thrombosis. Traveling for long distances in the aeroplane, as I mentioned, especially when you sit in coach class, that can cause you to develop a deep vein thrombosis. Studies have shown that people who travel for 4 hours or longer are at greater risk. The diagnosis of a deep vein thrombosis is usually made by the history of leg pains, the doctor examining you, finding tenderness in the leg with some swelling and redness, and also by the use of an ultrasound test of the leg, which shows the clot. Treatment for deep vein thrombosis is usually using blood thinners or anticoagulants. The two main groups are heparin, which is an injectable blood thinner, and then the oral blood thinners are called Coumadin, or also known as warfarin. Those are tablets and are usually taken in various dosages on a daily balance. These drugs do not actually dissolve the clot, but they prevent new clots from forming. Thrombolytics are drugs that are used to dissolve a clot. This is usually done in a hospital or an emergency room, as overdosing can have serious consequences and lead to excess bleeding. People who take anticoagulants have a greater risk for bruising and bleeding, and it is therefore necessary to do frequent blood tests to manage the thinness or thickness of the blood so that it does not become too thin. Eventually, it's done a few times a week, and once you become stable, then it's usually done at monthly intervals. The general accepted period of time that you stay on anticoagulants for a first-time DVT is approximately 6 to 9 months. For those people who cannot take the anticoagulants, a special filter is placed in the large vein of the abdomen called the vena cava. This filter will then prevent pieces of the clot breaking off and landing up in the lungs. Compression hoses are also used for deep vein thrombosis or compression stockings. These help constrict the vein and prevent swelling from the legs. While in bed, if you have a deep vein thrombosis, first of all, you should not spend too long a time in bed, but if you are, when you sleep, you should wear the compression hoses as well. Exercising can help prevent deep vein thrombosis, so that when you fly, especially in coach class, stand up frequently and walk, say, every hour up and down the aisle. And when you're sitting down, flex and extend your ankle frequently, and this will keep the blood circulating, preventing a deep vein thrombosis. If you are overweight and develop a clot, then a sound nutritional program should be prescribed, as well as exercise. On my website, drmedicalhypnosis.com, drmedicalhypnosis.com, is a lap band, virtual hypnosis lap band surgery for you, which will help you lose weight, and nutrition and exercises are included. And any purchaser of that or any of the other 26 health hypnosis videos receive complimentary weekly telephonic calls on an ongoing basis from me. My name is Dr. Hillel Mazansky, and I thank you for listening to this health tip.